Hi there. I'll just give it a couple of seconds for everyone to join. All right. It looks like some people are still joining, but I think we can get started because we have a lot of vendors here today, so it's really great. My name is Shell Wong. I am from the Department of Healthcare Services. Really excited to have everyone here for our second TA Marketplace Vendor Fair. This vendor fair is going to be focused on Domain 4, which is Enhanced Care Management. And we can go to the next slide. So from DHCS today, we have Michael Wizar, myself, and Jasmine Garcia. Also joining from Public Consulting Group, our third-party administrator, we have Trish Perizzelli, Eliza Met, Jenna Wall, and Danielle Feldman. And we can go to the next slide to go over some of the goals. So we're going to start with an orientation to the TA vendor fairs for those of you who haven't joined one of these before. Then we're going to showcase our TA vendors and have them speak on their services and projects. Towards the end of today's meeting, we'll share some resources on the TA Marketplace as well as updates. And then time permitting, we'll have a little open Q&A. And so going to the next slide, really the purpose of our vendor fairs are just to give an opportunity for our vendors to share information about their organization and the services they provide to those potential TA recipients and really support that utilization of the TA Marketplace. And so today is the second of 5 virtual vendor fairs that are going to be held through April of 2024. And these are going to be split across all of the 7 domains. And with that, I'll pass it over to Jenna to talk a little bit about today's fair.
Great. Thanks so much, Shell. As Shell noted, today's vendor fair is focused on Domain 4, which is Enhanced Care Management, strengthening care for ECM populations of focus. So vendors in Domain 4 have the expertise to support TA recipients better understand and navigate the requirements of CalAIM and Medi-Cal Managed Care Delivery System, and also leverage the numerous opportunities made available under CalAIM. So that includes cited, collaborative planning, justice involved, et cetera. And here is just an example of all the different projects that might be provided under this domain. But of course, we also have those individualized hands-on projects for which all of the vendors who are presenting today are also permitted to provide TA for. So I think we can go to the next slide. So just a high-level agenda for today. We're doing our welcome and introductions. We will then have about 35 minutes for vendor pitches. So those vendor pitches are about 1 minute from each vendor. We will then move into the breakout room sessions, which are really meant to be a time in which the attendees and vendors can meet to ask questions, provide a little bit more information about services offered by each TA vendor, et cetera. And then we will open or come back to the main room where we will have just a few resources that we will be sharing with you all today, open it up for general Q&A for the TA Marketplace and some closing remarks. So I think we can go to the next slide. So just some Zoom logistics before we get fully started here. So please be sure that you have the Zoom application downloaded to your device and that you have joined via the Zoom app to ensure that you are able to successfully participate in breakout rooms. Unfortunately, Zoom does not allow you to join breakout rooms through through a web browser. So just be sure that you have that Zoom app to be able to participate in the breakout rooms. Additionally, we do have a Q&A functionality here in the main room to ask general inquiries regarding the TA Marketplace, or if you have any technical issues that we can work with you on. But we do ask that if you have specific questions for a particular vendor, that you save those questions for that breakout room session. Next slide, please. All right, so I think we can go ahead and get started with vendor pitches. Next slide. Vendors will be presenting in alphabetical order today. There are 24 presenters, so you'll be hearing 24 great pitches. Vendors will have 1 minute to present their organization. And again, just highlighting that there will not be any questions answered during this time. We ask that you write those questions down for those breakout sessions. All right, so I think we're going to get started. We can go to the next slide. So our first presenter today is 43 Strategic Consulting.
Good morning, everyone. 43 Strategic Consulting is a woman of color owned and led company founded by Catherine West. 75% of our team identifies as a member of a historically marginalized community, and our approach is grounded in principles of equity leadership. We are a collective brain trust of consultants who have deep experience leading in mission-driven and community-based organizations with a proven track record in facilitating collaborative partnerships across diverse agencies. Our team includes practicing clinicians and experts in Medicaid, social determinants of health, health-related social needs, care management, value-based payments, primary care redesign, digital equity, housing, workforce, performance improvement, risk adjustment, and communications. Our commitment is to ensure that the organizations we work with improve their revenue to sustain their mission and impact. I encourage you to reach out to us to have a conversation about your organization's goals. We are an approved vendor for domains 2, 3, 4, 5, and 6. We welcome the opportunity to co-design and innovate with you. Thank you.
Great, thank you so much, Jenny. I think we can go to the next slide where we have Apt Global.
Good morning. I'm Katie from Apt Global, a consulting firm with a 60-year history focusing on improving the quality of life and economic well-being of people worldwide. We developed a similar TA program in Massachusetts to help community-based organizations implement health reform and have decades of experience providing TA and training resources for a diverse array of community-based TA recipients across a wide range of topics. We've developed a highly flexible and responsive approach to designing and implementing training in TA and are available to support you across all 7 domains. In domain 4, we can support organizations in identifying the areas in which they would like to build the capacity and infrastructure needed to implement ECM. Some examples of TA might include supporting organizations and strengthening outreach and engagement to populations of focus, developing resources and training for frontline staff like CHWs or mobile crisis responders, and developing data analytics tools to help track progress and evaluate your programs. I will be in breakout room 1 and look forward to speaking with you further. Thanks.
Great, thanks so much, Caitlin. We can go to the next slide where we have Advocates for Human Potential.
Thank you, and good morning, everyone. My name is John Brumbach, a senior associate with Advocates for Human Potential, or AHP. AHP was founded almost 40 years ago as a mission-driven training, technical assistance, and consulting firm focused on driving systems change across our health, behavioral health, and social safety net systems. Since that time, we have established deep roots in California with nearly 100 staff across the state with extensive subject matter expertise in care management, workforce development, and evidence-based practices. Our approach to ECM TA is to build a strong partnership with your organization, meeting you where you're at, and to address your unique needs for staff development and organizational capacity. Additionally, ECM services are only as successful as the connections you and your organization have, and so we are in a position to support you in leveraging our California presence to facilitate partnerships across key systems, including behavioral health facilities, services for the houseless, criminal justice systems, and more. So we look forward to working with you and to the continued discussion in breakout room 2. Thank you.
Thank you, John. We can go to the next slide where we have Camden Coalition.
Hi, all. I am Carter, and we are the Camden Coalition. We are a community health nonprofit that for the past 20 years has been delivering sort of ECM and community supports like services in our community of Camden. We have been running high-touch community-based care coordination programs. We run a Housing First program. We run a medical legal partnership. We manage the region's health information exchange and social information exchange. And so to use that data infrastructure as well as the sort of the relationship infrastructure we built in order to connect with those other partners that's necessary for this work. And so for the past 10 years or so, we have also helped other organizations and communities develop similar initiatives for their communities. So we can help you in 4 ways. 1, we can help strengthen, integrate your ECM program that really tailored to your population. We can help you build the relationships and leverage the data infrastructure that you have to connect with those partners. We can help you integrate people with lived experience into care delivery or advisory or governance roles. And we can help you support your team members, right? This work is burnout, hard work. Nobody was trained to do it. We can help train that staff, not only to deliver the work with patients, but also to work with one another. We'll be in breakout room 3, again, with the Camden Coalition, 123 Camden. Thanks so much.
Thank you, Carter. We can go to the next slide, where we have Center for Healthcare Strategies.
Hi, everybody. Good morning or good afternoon, depending on where you are. Chris Menschner, Director of Complex Care Programs at the Center for Healthcare Strategies, or CHCS. CHCS is a policy design and implementation partner devoted to improving outcomes for people enrolled in Medicaid. CHCS works across sectors and disciplines to make more effective, efficient, and equitable care possible for millions of people in the United States who face serious barriers to well-being like poverty, complex health and social needs, and systemic racism. For more than 25 years, CHCS has collaborated with state Medicaid and related health and human services agencies, as well as health plans and provider organizations, and most importantly, people with lived experience across the country to shape how healthcare services are designed, financed, and delivered. We have deep expertise in Medicaid policy and financing. And through our work over the years, we've partnered with innovative provider, health system, health plan, and state partners to pioneer more effective models to improve care and reduce unnecessary utilization. We often form our work in the shape of learning collaboratives, which convene key stakeholders and peer groups to learn from each other, share challenges and solutions, and pilot innovative strategies with technical assistance and capacity building support. We have deep experience in California, and we're currently working on a Partnerships for Action initiative, which brings together homeless sector and healthcare providers.
Thank you,
We'll be in breakout
Christopher.
room 4.
Breakout room 4. Thank you, Christopher. Appreciate it. We can go to the next slide, where we have course. And Ryan, can you just come off mute?
Muted. Sorry, first fail. Sorry. Chorus, I'm Ryan from Chorus. We're a digital health technology company centered around the idea that healthcare is always local and each system of care is unique. But while each county or region system of care is unique, their core problems are not. Disjointed and disconnected technologies make the sharing of information across service lines, both internally and externally, very difficult. So people are still using phones and spreadsheets and whiteboards to track clients across the system. And we know enhanced care management providers feel this pain most acutely. Chorus is not an EHR system. Instead, we work with counties and ECM provider partners to leverage our library of digital templates to build tailored infrastructure and specialized workflow tools that unify disjointed systems and drive seamless, efficient care coordination. Diagram on our slide right here shows how these templates integrate and work together to drive that seamless care coordination that's necessary for effective enhanced care management. I'd love to share more about what we bring to the table as a partner, and I hope to see you out in the breakout sessions.
Great. Thanks so much, Ryan. We can go to the next slide, where we have ClearLink Partners.
Good morning. My name is Irma O'Brien. I'm the VP of Population Health for ClearLink Partners. We are leaders in the managed care consultancy, specializing in clinical operational and market expansion initiatives for all lines of business. Our expertise in the enhanced care management program includes ECM model development, implementation, and optimization. I want to highlight our outcomes for identifying, engaging members who are eligible for the ECM programs. We can create your policies, procedures, workflows, and trainings, as well as offer operational and compliance monitoring. ClearLink's industry experts are focused on community-based organizations, linking members with SDOH needs with supports and services. We have solved countless roadblocks for top-notch health plans, managing complex member populations, and we welcome the opportunity to partner with your organization, and we will be in breakout number 5.
Thank you, Irma. We can go to the next slide, which is Coalition for Compassionate Care of California.
Good morning. The Coalition for Compassionate Care is the only nonprofit in the state working across sectors and disciplines to equip clinicians with the knowledge and skills required to assist patients and their families to live well, even with serious illness. CCCC has 20 years experience training clinicians, care managers, and CBOs focusing on advanced care planning, the physician orders for life-sustaining treatment paradigm, palliative care, and the knowledge and skills required to have hard conversations about choices for treatment and care that clients will have to make. Our unique off-the-shelf offering is Let's Talk, promoting and engaging in advanced care planning. This 6-hour training, which can be conducted in person over a full day or virtually over 2 half days, includes essential information, skills training, role plays, and interactive exercises to fully equip ECMs. At CCCC, we know that care management begins with understanding clients' needs, hopes, fears, and wishes. These conversations are difficult, but the skills can be learned. So let's talk. We'll be in breakout room 7. Thank you.
Thank you so much, Jennifer. We can go to the next slide, where we have Consilience Group.
Good morning, everyone. My name is Juanita Ortiz, and I work with Consilience Group. We're a woman-owned organization with over 20 years of national experience helping organizations like yours and agencies, both big and small, enhance their coordination with a focus on helping create equitable outcomes. So most recently, we've had the opportunity to work with 20 community-based organizations in California, much like you, and helping them really get ready to deliver services and enhance their ability, their capacity building for ECM services. Many of the organizations that we work with are BIPOC-led, smaller, younger, grassroots organizations that have close ties to the populations of focus. And so we would be delighted to have the opportunity to further explore your needs and provide the services that you need. Like many of us on this call today, we have a range of services around capacity building, strategic, planning and assessment, and how to deliver these services in the best way possible. And we would just be thrilled and honored to be able to partner with you to meet your needs. Thank you very much. I believe I'm in breakout room.
Great. Thanks so much, Juanita. We can go to the next slide, where we have Cope Health Solutions.
Good morning, friends. How y'all doing? Appreciate you coming back for vendor fair number 2. We are a national tech-enabled value-based services firm. We're based here in Los Angeles, but have team members nationally. We've worked in the Medi-Cal space for over 20 years, particularly here in California, working across the past 5 waivers, working with a combination of health plans, provider organizations, and community-based organizations. Part of what we bring to the table is we are approved for all 7 domains, so we can really help you from end-to-end to launch, from initial assessment, what are my gaps to goal, what are the program models I have to have in place, how to perhaps I configure and implement the tools that I do have, where do I need to acquire additional tools, training or competencies, and of course, optimization. How do we best engage with our health plan partners, our communities, to make sure we're delivering the quality and outcomes we want to be a high-performing group under the CalAIM program. We have a number of proven models, both for care management, risk stratification, and analytics that we can help team members utilize as best practices or configure with their own tools and programs. Within Domain 4, in particular, we think it's really important to make sure that we really modify and adapt based on where you're at. So first beginning with an assessment, what are the current capabilities and programs, what's the experience, and then moving into development of the right tools and programs for implementation. Looking forward to seeing you more in breakout room 8. Thank you all.
Thank you so much, Evan. We can go to the next slide, where we have Elevation Health Partners.
Hi, I'm Jessica King from Elevation Health Partners. I have worked with over 20 FQHCs as the CalAIM subject matter expert for the Clinic Association of LA County. You may know Elevation Health Partners through our work on HealthNet's Quality Improvement Manager project. We worked alongside HealthNet's HEDIS team, MedPoint Management, Memorial Care Select, and 36 provider organizations to improve administrative data through supplemental data, documentation, EHR build-out, and coding, or as the coaching team behind the top 3 performing practice transformation networks in the country. Right now, we are working with over 10 clients on the Path PA Marketplace and cited projects. We are a great fit for you if you require expert coaching for boots on the ground implementation, making the best use of your limited resources, or need an end-to-end support from understanding the marketplace to implementation of complex projects like data and technology. We love doing this work, but don't take it from me. Our client, Matthew, the ECM director from THE, will join me in breakout room 3 to help answer any of your questions. See you soon.
So much, Jessica. We can go to the next slide, where we have Just Whole Care, which is Goldfinger Health on the TA Marketplace.
Thank you, Jenna, and good morning, everyone. I'm John, the founder and CEO of Just Whole Care. As a California pediatrician whose career actually began as a navigator, I know healthcare wasn't designed with everyone in mind. Mothers, babies, home visitors, child welfare staff, TA, and you can forget anyone with behavioral health needs or involved with the justice system. I started Just Whole Care, making health equity connections a reality for these and other marginalized groups decades ago. We've developed since population-specific, digitally powered expertise in how Medi-Cal and other systems coordinate and improve cash flow, particularly dyadic care, bringing families what they need, where they need it for their children to thrive. Or trauma-informed networks, connecting care for youth with ACEs or other serious behavioral health challenges like suicide or overdose risk with resources. Given life's a circle, we really help healthcare become seamless across generations, time periods in life, and systems. Reach out with any ECM population challenge, and we'll be glad to help.
Thank you so much, John. We can go to the next slide where we have Factor.
Good morning. My name is Lelania Ramirez with Factor, a healthcare consulting company that has worked closely with health centers in California since 2001. To date, Factor has provided ECM support to over 20 different organizations and has also been part of the ECM rate setting conversation at the health plan level. In addition, Factor has been able to utilize the TA marketplace with several current and past clients and has a 100% TA marketplace proposal approval rate. Factor is able to support with all ECM related needs. You are able to build a program from scratch, trying to improve efficiency or sustainability, or look to increase the number of patients you serve. Past projects include ECM strategy development, infrastructure, and building workflow redesign optimization, including coaching of ECM directors and even interim work with the eye towards financial and clinical sustainability. Thank you so much for your time, and we look forward to seeing you in breakout room number 6, where my colleague Heidi Chu will be able to answer any questions you might have. Thank you.
Great, thank you so much. We can go to the next slide where we have Hansard Health Solutions.
Good morning. Nice to see you all. Hansard Health Solutions knows that winning systems are simple, easy, and organized. This is our wheelhouse. We believe that when any one of us is in a vulnerable position or in a health crisis, that we shouldn't have to know the magic words, knock on the right doors, or follow up 5 times. So we advocate heavily for the voice that's rarely in the room when important decisions are made. Having worked on many projects like this, we know what are the important levers to pull to get impact. And we push for uncompromised designs that often surface barriers and burdens that would typically go unnoticed because they're so normalized. As we work with your teams, we aim to spark a culture of excellence that continues to innovate and solve problems long after we're gone. So you should want to work with us because we are savvy change agents who know how to start up, strengthen, scale, and sustain your care management programs. I look forward to talking with you, and we will be in room 8.
Thank you. We can go to the next slide where we have Health Management Associates.
Hi, good morning, everyone. My name is Christina Altmeyer. I'm Senior Vice President at HMA. HMA is a national consulting firm with a long history of work with plans, providers, and payers throughout California. We have 4 offices in California. We are available to support you in all 7 domains with experts that focus on clinical, operational, financial issues related to implementation of ECM. We're working with a range of organizations via the TA marketplace already, including county agencies, community-based agencies, clinics, and other organizations. I think what makes our approach unique is that we recognize and have experts in each of the eligible populations of focus. So we recognize that the implementation strategy and the model of care has to be tailored to the population that you're working to achieve, whether that's children, juvenile justice, the unhoused, seniors, and that's the focus of our work. So we're excited to learn more about your needs, and please join us in breakout room 5 to learn more. Thank you.
Thanks so much, Christina. We can go to the next slide where unfortunately, I do not think that we were able to have a panelist join us for Innovation Horizons and Health Policy Matters. But if a member of their team is able to join us later today, I believe that they are in breakout room 2. So I think we can go to the next vendor side, which is Intrepid Ascent.
Hello, good morning. I'm Alexandra Milliton with Intrepid Ascent. We are a strategic consulting partner for community health transformation based in Berkeley, California. Intrepid Ascent provides capacity building and technical assistance to community partners from healthcare, government, human services, housing, schools, and allied sectors for collaborative design, governance development, and technology guidance. We seek to help achieve community health transformation through collaborative approaches to people-centered care at the local level. Our TA services cover the spectrum of technology adoption needs, from assessing and creating implementation plans, establishing frameworks for community and data governance, procuring and implementing solutions, and designing workflows to help enable cross-sector care coordination, analytics, and data exchange. Whenever possible, we promote shared local infrastructure that delivers value across multiple programs and initiatives. Organizations that might benefit from our technical assistance include CBOs who are contracted with the health plan for the first time, ECM or community supports providers navigating CalAIM requirements, and organizations looking to improve their compliance posture and/or technology infrastructure. If you're interested in learning more about how we can work together, I encourage you to join us in breakout room number 7.
Thanks so much, Alexandra. We can move to the next slide, where we have Maeda Consulting. And Katie,
I'm so sorry, couldn't find my mute button. Hi, everybody. I'm Katie Maeda, and I am with the Maeda and Maeda Consulting. The thing that sets us apart is one, we are a very small organization working directly with you in California. We are located in Santa Cruz, but work all throughout California. We are in the business of using evidence-based practices in order to provide high quality services. What I mean by that, because that's a lot of buzzwords, is motivational interviewing, trauma-informed care, harm reduction, crisis intervention, the growth mindset, all of the above. We take those principles and we apply them into a large organizational change. And our goal is to make sure that you have more time to address the needs of the clients. And so for us, we would love to work with you because I'm known for giving you back time. So we could guarantee 20% of your time is given back to you because of the systems and the efficiencies that we're able to make that are clear, concise, and to the point. So we are going to be in room 6. So if you have any questions, please come and meet me.
So much, Katie. We can go to the next slide, where we have policy to practice.
Good morning, everyone. My name is Christina Nolf. I'm a licensed clinical social worker and the founder of Policy to Practice Consulting. I'm in Long Beach, California. The new services and significant changes to Medi-Cal brought about by CalAIM can feel overwhelming. I created 3 trainings to help your organization and workforce members really understand the basics of CalAIM and enhanced care management. These video trainings are offered to help your staff, especially those who are on the front line, really connect the complex Medi-Cal requirements with high quality, equitable service. CalAIM 101 covers the history, goals, values, and components of CalAIM. ECM 101 describes the start to finish process of ECM. And then ECM with foster youth applies the best practices from the KDA lawsuit settlement to ECM with this population of focus. Thank you so much.
Great, thank you so much. We can go to the next slide, where we have Primary Care Development Corporation.
Hi, good morning, everybody. My name is Christina. I'm with Primary Care Development Corporation. We are a 30-year-old nonprofit that exists to expand access to primary care. We do this through policy advocacy, through capital investment. We function basically as a community bank, and also through coaching, training, and technical assistance. And that's where I sit within the organization. I am a senior director at PCDC, and I manage the body of coaching and training work that we have on the West Coast. I'm based in Los Angeles County, but we have been working in CalAIM throughout the state. All of our work in California and CalAIM to date has really been around enhanced care management. We are in 3 domains. We're certified in the domain 1, 4, and 5, health equity, ECM, and data governance. But like I said, a lot of our work is focused on ECM. Our work to date has really been on working with organizations that are setting up enhanced care management for the first time, or in the pre-work of ECM and deciding whether or not enhanced care management really works for an organization and can be set up in a financially responsible and sustainable way. Our work, this is a direct reflection of our primary areas of focus, which tend to be financial health and care model and operations. We focus on all of the nitty-gritty, unsexy work that keeps a clinic functioning and running and maintains access, and if not maintains, increases access to primary care in the community. I'll be in breakout room 5. Thanks.
Thank you so much. We can go to the next slide where we have quantified ventures.
Hello, I'm Rebecca Gare with Quantified Ventures. QV has extensive experience supporting organizations to implement CalAIM. On the TA marketplace, we have both off-the-shelf and custom options for both current or potential ECM providers. We specialize in helping you design or optimize a sustainably financed ECM program. We assess program models, develop value propositions, and recommend how your organization could maximize outcomes to align with payers and ensure sustainable funding. We have worked across nearly all populations of focus and have particularly deep expertise supporting organizations that work with people experiencing homelessness, people with SMI or SUD needs, individuals transitioning from incarceration, pregnant, postpartum, and birth equity, and nursing facility transitions. QV provides guidance on leveraging CalAIM to align with organizational goals. I'll be in breakout room 6, and I look forward to partnering with you. Thank you all.
Thanks, Rebecca. We can move to the next slide where we have Thurman Consulting.
Good morning. I'm Isaiah with Thurman Consulting. Thurman Consulting is a multifaceted consulting firm based out of Sacramento, California. We primarily have been serving the populations of focus for homelessness, health and SUD needs, and incarceration. What really sets us apart as a firm is that most of our clients, as well as most of the staff that we have brought on board, have extensive experience from the ground level, really that boots on the ground. So we have a lot of experience working with you where you're at. And so we take a hands-on approach. We've been a part of the process, knowing that, starting in this can be difficult, or if you're farther along in the process, it can be difficult maintaining and managing the system. So we're there with you. We provide that hands-on approach to, fit wherever we can, where you need assistance, especially around the regards of policies and procedures and implementation. So we're excited to work with you and to help you find creative solutions to whatever you're facing right now. We'd love to talk with you more. We'll be in breakout group 7. Thank you.
Thanks so much, Isaiah. We can go to the next slide where we have Transitions Clinic Network.
Hi, everybody. My name is Emma Steiner. I'm the Associate Director of Transitions Clinic Network. I took these slides very literally, so you can read our offerings here. We are experts in the intersection of carceral systems and health. We have over 14 years of experience in building capacity among health and other systems to better serve individuals returning from incarceration. That is, we offer things from a year-long implementation of our evidence-based program shown to improve health and reentry outcomes, down to consulting. We have foundational trainings. Our staff, which is more than half of our staff, has lived experience of incarceration. We have participated in the DHCS Justice Involved Stakeholder Group. We have participated in the federal process on the 1115 Medicaid waiver, and really have deep expertise and a deep passion for improving the health and well-being of individuals transitioning from incarceration, and we'll be in breakout room 3.
Thank you so much. And last but not least, we have True Management Services.
Hi, everybody. Sergey Shkirkin, CEO and founder of True Management. Since 1994, the true mission of True Management is to identify and secure financial resources for community-based organizations and local governments. Since 2021, we've assisted agencies to become CalAIM contractors. True Management Services has been providing TA market vendor services since August of 2023, providing assistance through 80 approved projects. We offer 15 off-the-shelf products across 6 of the 7 domains. The proof of our effectiveness providing TA is the fact that 95% of TA recipients who've received our TA previously to TA Marketplace have signed up for additional projects. So everybody loves us. Our Domain 4 offerings include the following off-the-shelf products: implementing ECM into an already existing case management system, motivational interviewing for ECM, CalAIM mock ECM audits. If you want to learn more, join me and members of the True Management team in Breakout Room 8. Thank you.
Great, thank you so much. And thank you again to all of our vendors here today who presented in that 60-minute second, which I know is very, very hard. So we can go to the next slide where I'm going to just give you some brief details about the breakout rooms before we move to those. So breakout rooms, again, are an opportunity for attendees to ask questions of TA vendors and hear more detail about their projects and services. We will begin by giving brief introductions of those vendors and then open it up for questions. We do request that all attendees use the raise hand feature at the bottom of your screen. So you will raise your hand. A member of the TA Marketplace team will call on your name and ask you to come off mute and ask your question. We do request that you remain on mute during the breakout sessions when you are not asking a question to minimize background noise. Messages will be sent to all breakout rooms at the 5 and 1 minute marks. We will be meeting back here in the main session at 10:15 to just conclude with some Q&A and some more resources on the TA Marketplace. And again, I do want to do that one last blast to please ensure that you have joined this meeting using the Zoom app downloaded to your device to ensure successful participation in the breakout rooms. If you have joined by phone or browser, we ask you that you rejoin via the app at this time. Can go to the next slide. So you will automatically be assigned to a breakout room. However, that does not mean you need to remain in that breakout room. You will have the ability to move throughout the breakout rooms for the duration of that time period, so until 10:15. We will be sharing a slide that shares the names of each vendor and what breakout room they're in. You will be able to do that by identifying that breakout room number that you would like to move to, clicking breakout rooms at the bottom of your Zoom application, and a pop-up will appear with a list of those breakout rooms, and you just click join to join the breakout room that you would like to attend. But again, you will be randomly assigned and be able to move between breakout rooms for the duration of those 30 minutes. We can move to the next slide where we have those TA vendor breakout room assignments. So there are 8 breakout rooms and we will have about 3 vendors per breakout room. A slide similar to this will be presented to all attendees during the breakout room sessions, indicating what breakout room you are in and how to move between those breakout rooms again. So with that being said, I think I can turn it to Danielle to see if we can start those breakout rooms.
Great, thanks so much, Jenna. I'm gonna first go ahead and pause the recording.
Thank you everyone for attending those breakout sessions. I hope that you had fruitful conversations, were able to engage with the different TA vendors, and hopefully found someone that can support you under Domain 4 Enhanced Care Management. And we look forward to seeing your applications. So we want to reserve just a little bit more time to just provide a quick overview of the TA Marketplace website and some resources for you all. So if we go to the next slide. So if you want to visit our homepage, you'll get much more information about how to access the marketplace, how to apply to be a recipient. You can use the link down below. It's ca-path.com/TA-marketplace. Here you will see all the different cart or web pages, project types, so those hands-on, off-the-shelf projects, the different domains. So if you're looking for some work outside of domain 4, you can learn more about the other 6 domains on the TA Marketplace. And also information about how who is eligible to become a TA recipient and how to become a TA recipient and apply for that TA project. Of course, you are also welcome to contact us with any questions, and our email address is listed here. It is ta-marketplace@ca-path.com. We can go to the next slide. So just want to dive in a little bit more into the website. So this is a new feature as of December, January of this year. Each vendor profile or vendor has their own vendor profile card. You will see smaller cards of each vendor listed on our website, where they'll give you a brief synopsis of their organization, the domains in which they are approved on the TA Marketplace, as well as contact information, including email and website address. If you click on that particular vendor profile card, it'll take you to their main page on the TA Marketplace, where you will see a longer summary of their organization. You will also see all of the services that they provide, those domains for which they are approved, as well as those hands-on and off-the-shelf project services. We also have some client testimonials if you would like some information about real experience with these TA vendors. If you go to the next slide. All right, so exploring the marketplace. So once you navigate to our webpage, at the top right-hand corner, there will be a button on every page that says Explore the Marketplace. And this is where you can find those off-the-shelf projects, you can find those vendors, and find out a little bit more information about those vendors and projects. So for example, here, you will see a random list of projects that appear. If you click on an off-the-shelf project, as we do here, you will see a summary of those that off-the-shelf project, including those project objectives, and kind of gives you just more of that high-level information about the project itself to see if it's a good fit for what you're looking for. And so we encourage you to look on the marketplace, see if there is an off-the-shelf project that suits your needs, a vendor that suits your needs, and feel free to reach out to the vendor listed on that vendor profile card showed previously to see if it's the right fit for your organization. You can go to the next slide. Also on the TA Marketplace webpage, we have added filters. This is new as of January. So to enable you to find those services that really fit your needs, we've asked all the vendors to apply at least, I think it was up to 3 flags or filters per project as well as per service that really, matches their services the best. So we have different filters based on the domain, the TA need that you're looking for. So if you're looking for something regarding billing and coding, we have projects, under that flag. If you're looking to contract with a managed care plan and don't know how to do that, we do have a TA needs filter for for contracting. We also have it by population of focus. I know in my breakout room, we had some questions about populations of focus. So those filters are available there. And also find a vendor. This just allows you to search for a particular vendor so you can easily navigate to their vendor profile. We can go to the next slide. And just a little bit more information about TA recipient eligibility. So as a reminder, if you are an approved recipient and you go through the process of getting an approved project, these services are free to you. That is paid under the PATH initiative. So these are examples of entities that can shop the marketplace: CBOs, counties, cities, or local government agencies, Indian health programs, FQHCs, and other providers. But we also have others approved by DHCS. So if you are contracted with a managed care plan or are planning to contract with a managed care plan, you can apply for these services. And what you will do is download the form on our website, get that signed by the managed care plan in which you are contracted or engaged with, and then click the Apply Now button to start the online application. If you are not yet engaged or contracted with a managed care plan, no fear. We just ask that you submit some questions to or some answers to us to these questions above. And this is again available on our website. Just giving us a little bit more information about your organization and what you intend to do with your projects or TA received on the marketplace. So with that, I think we are at the Q&A period. If we go to the next slide. So I encourage you all to use the Q&A feature at the bottom of your screen. We will be able to answer those questions live here. And if for any of those that we are not able to get to, we will be sure to include those in our Q&A document that will be sent along with, again, these slides from today's presentation. So I do see this first question here. Are we able to have more than one TA project going on at the same time? An example with an off-the-shelf ECM and also off-the-shelf for workforce development. The answer is yes, you can have more than one TA project going on at the same time. We just will be asking maybe a question about making sure that is not duplicative. So for your example about enhanced care management and then workforce development, those seem to be two very different projects to me, but we would probably just ask a little bit more detail confirming that there is no overlap between those two projects. And also we would just want to make sure that you have the capacity and time available to receive those services. But we do currently have recipients that have more than one project active at the moment. So we definitely encourage you, if you need those services, that you apply for them. Yes, kind of a related question I see from Carol here. Are we able to use a variety of vendors for different functions? Yes, you do not need to choose and stick with one vendor on the marketplace. If there is one vendor that maybe is more specialized in helping you contract with a managed care plan, we encourage you to work with that vendor, but maybe another vendor that can help you with enhanced care management and getting trainings for those services, you may use that vendor. And again, those two projects can be going on at the same time if your agency or organization is able to support that. But we will just want to confirm that those projects are not duplicative. So we might just reach out to you with a little bit more clarifying questions. All righty. I see. Can we get slides from the other domain presentations? Yes. So we are having, I believe at the start of the event, we stated that we are having 5 of these events from February through April. We are happy to share those slides from all of the different vendor fairs. Just send us an email if you did not receive the one from Domain 3. We did send it to all of the attendees, but we can definitely send that over to you. We also intend to post these slides in the vendor pitches to the website. We'll be kind of putting them all together as a package that we'll make available on the website. And we will also be encouraging vendors that we're not able to present to share a vendor pitch slide and get that posted. All right. So I have a question here about hubs, about details on how to apply and scope out a project request for a hub TA marketplace. So I am going to assume just one thing here is that you are the hub that is looking to receive TA services on behalf of several other organizations. And if that is the right assumption that you are the hub, that you can actually just sign up as a recipient. For hubs, we might just ask you during that period a little bit more information about the types of organizations that you work with. If you have those organizations listed, that is very useful information to us. And then when you actually apply for a TA project, so once you are an approved recipient, you apply for that project eligibility application and scope of work and budget, we will just ask for the specific organizations which you are representing under your hub entity and the organizations that will be receiving the TA services. Great. We do have about 5 more minutes, so give it a few seconds to see if we have any other questions coming in. Again, I do encourage that if you do have any questions following today's vendor fair, please feel free to reach out to us. That is ta-marketplace@ca-path.com. And I see our regional centers eligible for PATH TA. I think we might just need a little bit more information about this, about what your organization does. As a reminder, recipients must be planning to or already providing enhanced care management or community supports to Medi-Cal members. So if you reach out to us, we'll be sure to steer you in the right direction to see if you are eligible and which pathway you should apply. All right, so I'm not seeing any other questions come in, so I think we can move to the next slide, where we just have a little bit of wrap-up information to share. So as I said, we have 5 vendor fairs in total. So this is the second one we've hosted since starting those. So the next vendor fair is going to be focused on domain 1, which is building data capacity. And that is scheduled for Thursday, March 28th at the same time. So 9 to 10:30 a.m. Pacific time. And then our future webinars will be hosted in April, where we will be combining domains 2 and 7, so community supports and workforce, and then combining 2 domains, so domains 5 and 6, health equity and supporting cross-sector partnerships. Again, to register for those events, you can either register through the newsletters that you might have been receiving about these events, but we also have registration listed on the TA Marketplace under upcoming events. So if you go to our homepage, just scroll all the way to the bottom and you'll see the link to register for these future events. We can go to the next slide. We do have a survey that will be sent out shortly after today's call. You can also use the QR code here to share your feedback. We are really looking forward to hearing about these events, seeing how we can improve. We do have 3 more of these events, so we would love to hear your feedback, and also just our future events, any ideas for future events and thoughts, as we really want to make sure that we are serving your organization and getting you the technical assistance that you need on the marketplace. So that survey will also be sent via email today. So look for that in your email or scan the QR code now. All right, and I think we can go to the next slide, which again, just a big thank you to everyone. I do also want to take a moment to thank you, all the TA vendors who are present here today. We really, really appreciate your time and getting, our vendor pitch slides in under 60 seconds and taking the time to answer all the questions in the breakout rooms. We really, really appreciate it. We hope you all enjoyed today's event. Again, if you have any questions about the TA Marketplace, please do not hesitate to reach out to us by email. That is the best way to let us know your questions. And with that, not seeing any other questions in the chat or the Q&A feature, I think we can end today's event, and we look forward to seeing you at the future ones. Thank you, everyone.